I'll start this one by saying that I'm not expert in philosophy, and I don't think it is necessary to be it in order to understand ethical positions like antinatalism. I also think that using proper philosophical terms and scholar teaching can be useless when the goal is spreading an idea. However, I would like to say something about the relation between antinatalism and the different ways of thinking about ethics. My main point is that antinatalism doesn't belong exclusively to a specific ethical theory or a single ethical system. Despite their differences, all the most common ethical theories are compatible with antinatalism, I think, or at least to some form of it. The reasons that characterize each theory varies, so of course each of them will have different arguments, but I think all of them can come to the same conclusion, which is that it is always wrong to procreate. In particular, I think both consequentialism and deontology, which are the most widespread and accepted ethical systems, can support antinatalist positions in a logical and rational way. The different ethical systems disagree on how to recognize right and wrong actions, so consequentialism, uh, consequentialist theories such as utilitarianism do not look at the morality of actions but only at the consequences. The other way around, deontological theories are based on principles, so they look only at the morality of actions and not at the consequences of those actions. So there are various theories that belong to each ethical systems. They have different roles that characterize them. There are also theories and ways of thinking uh, that include aspects of different ethical systems together, combined together. If I have to relate my ethical reasoning to the ethical systems recognized in philosophy, I think I use both consequentialist and deontological arguments. In defense of deontological theories and arguments, I want to say that they are not a way to escape responsibility or to feel with a clear conscience or some emotional uh, component interfering with the rationality or anything like that. They are just valid and rational kinds of ethical reasoning. Uh, Even with positive utilitarianism, it might be possible to reach an antinatalist position, at least regarding the indirect harm or misanthropic arguments. I think, if I'm not mistaken, for utilitarianism, procreation can only be accepted if the positive experiences caused are greater than the negative ones caused. So this calculation obviously depends on the weight given to the negative and positive experiences, but it is really difficult to hypothesize situation in this in which it can occur regarding procreation if we also take into consideration the experiences of the other beings affected by procreation. The most popular theory among antinatalists online seems to be negative utilitarianism, according to which reducing suffering is a priority. About this, I think it is important to note that this is not the only role of negative utilitarianism, but there are at least two more rules. One of them says that the intensity and duration of suffering and the number of beings affected can be summed together. And the other one says that the total amount of such an aggregation is what should be minimized. So this can be a position compatible with antinatalism, but is not the only Uh, it's not the only theory adopted by antinatalists, and it's definitely not the only one possible. I personally agree that reducing and preventing suffering is a priority, but I don't think that suffering can be aggregated in that way. I don't think, for example, that someone can be sacrificed or harmed for the sake of minimizing the total amount of suffering, which is what some negative utilitarians think. I tend to think that the individual has more importance than that. I will elaborate on that in my next video.